tuned in to The Andrew Lawton Show.
It's funny when I talk about these issues, which were, the dominant issues in the Canadian political landscape for the better part of 3 years, they do seem like relics of a bygone era. And I think they are. And I think it's a good thing that mandates are now just seen as so distant and so past and so old that we're not going to bring them back. The government of Alberta yesterday, I got a bit nervous because I saw a headline that it was reimposing masking restrictions in healthcare environments. But then you look at the fine print and you realize they're really just saying, yeah, but any individual hospital can come up with its own policy and override what was sort of a baseline that Alberta Health Services was putting forward. Now, whether they should have done it at all is something that you can discuss and debate. But the whole point is that we cannot allow the very unscientific way government approach these things to stand without being challenged. And this is why I've been a proponent of an inquiry. And this is not to besmirch the work that people involved with the National Citizens Inquiry are doing, but the final product, the final report will really have no basis in law, will not be a matter of the public record in terms of the government's approach to this. So I think we do need to have these discussions still. Kenneth Green has done a tremendous job. He is a senior fellow with the Fraser Institute and has a piece out, COVID-19 Hygiene Theater, Masks and Lockdowns, Solid Science, in quotation marks, or Science Veneer. Dr. Kenneth Green joins us now. It's good to talk to you again, Kenneth. Thanks for coming back on.
Good to be with you.
Science is something that is not a one-size-fits-all solution, I think. It's a process, and it's one that people will learn from and adapt, and you bring in new evidence, and you revise your hypotheses and conclusions. The scientific process, though, I'd say took a bit of a bludgeoning over the last 3 years, didn't it?
It did. And you put your finger on a very important point, which is people misunderstand what science is. We talk about the science, and there is no such thing as the science any more than there is the flow of water. It's a process, right? And so it's a process. Really, what it is, it's trial and error formalized. It's formalized trial and error learning. That is, you create a hypothesis, you do an experiment, you publish it, or you repeat it, you test it, you come to conclusions, you publish it, somebody else tests that. And it's an integrated trial and error learning, but it's not a authoritative voice at any given time. In fact, almost all of the studies that are being done will be wrong, right? They will not be repeated, and they will not be confirmed. And so when people invoke this entity of that we're following the science, that's not a thing. They may construct in their mind what science is at any given moment, but it's not really a thing. And the thing is, governments, when they did this, created a real problem, because they gave people the illusion that there was this fixed body of knowledge where all scientists come together and vote and say, this is reality, and that the government was just following that. But of course, looking back, if you actually look back at the literature that existed at the time, the body of scientific literature, which is a real thing, if you looked at that at the time that they were making their decisions to impose masking, to impose social distancing, to impose stay home, stay safe, 3 months to flatten the curve, 3 weeks to flatten the curve, 3 months to flatten the curve, 3 years to flatten the curve. If you look back at the actual literature that was published at the time, as a group called the Cochrane Library has done formally, what you find is there was no evidence that any of those measures would reduce the transmission of COVID, or the severity of COVID, or the duration of COVID, or which parts of the population were affected by COVID. The evidence was very, 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 very weak and inconsistent, but mostly negative. Mostly that is found, as a biological common sense would tell you. Viruses are not affected by much. Viruses are a force of nature. They're like earthquakes and tornadoes. It's very difficult for humans to influence a virus that is passing through a population of any kind. I think we have a problem with regard to the issue of how governments portrayed what they were doing with regard to science, because they corrupted. science. They corrupted people's understanding of science. They corrupted faith or belief in science, that science is a good way of knowing. And I think all that is all dangerous because
Yeah.
science is, in my opinion, I'm a scientist. I have to, I've trained in the sciences, like doctorates in environmental science. And I still believe science is the best way of knowing how the world actually works and empowers us to make the world better, make our better place for the world.
When you bring up the trust in science, I think that's a key point here, is that it's not even like in the long run what the government did really helped it. Because I think even very dutiful, diligent, otherwise obedient people that wanted to follow whatever Justin Trudeau and Theresa Tam were telling them will start to get suspicious when there can be a complete reversal. Like, I mean, the ones that we've all talked about here are, you don't need masks, don't worry about the mask, don't wear masks, to everyone wear a mask, from, border closures are racist, to we have to close the border, to, the vaccine will prevent transmission, to no, we never said it. Like, if they had approached this with a bit more humility and said, we are learning as we go, this is what we think now, and then we changed it because this came up, there would probably be a little bit more forgiveness there. But we didn't hear that. And in fact, the efforts that official institutions went to block dissent and criticism, which, as you indicated, Kenneth, is part of the process, just completely erodes that they were really interested in real science.
Yeah, I think that's right. I think there was actually a breach in the wall of trust of science as an institution, and particularly the idea of scientific medicine. I don't think we'll ever recover, or the public health agencies, the CDC, the Centers for Disease Control, U.S. Environment, the health, Canadian health authorities. I don't think they'll recover their reputation because it's what you said, which is at a certain point, there's this saying, which is, somebody posts something on Twitter, Twitter X, whatever you want to call it, and as people say, they said the quiet part out loud, and they shouldn't have done that, and which is they revealed their inner truth, which is that the government is not using science, and the people who were coming out saying that they were the champions of science. Also, we're stating things that would be shown to be, as you said, 180 degrees wrong within such a short period of time that it's undeniable to people that you point out the window, right? Somebody says it's raining out. You point out the window, it's not raining. There's a certain point where people can't deny that they're being misled. And I think that's happened. That I think COVID was a case in that of that sort, where the complete turnaround was so obvious. And when they finally resorted to saying the science is changing day by day, even people who have no background in the sciences have to understand or know that science, because you have to do experiments, you have to publish them, you have to do and so forth, can't change day by day.
Just one quick question in closing here, Kenneth. I mean, in politics, there's a desire to move beyond this and really not to live in 2020, 2021, 2022, which I'm sympathetic to. In science, is there still a bit of lingering curiosity? Have your colleagues in various fields of science thought that, maybe we should go and look back empirically, did this work? Did this work? Or have they sort of tried to move on as well?
Well, I'm not embedded at a university or in the institution of science these days. I'm not in the
which is why you're so reliable.
But those of us on the outside tangential side who are analysts or students of what's going on in science certainly think something needs to be done, and there are more and more polls and things coming out showing that people just don't trust the science anymore. I find that troubling, and I've said the same thing as you have, or something similar to what you have, which is until there is some process of reconciliation, some process of admission by the agencies, not just, well, we should have communicated better, which is I think the highest they've gotten at the U.S. health agencies. Well, we need to communicate more and better. Until there is actually some sort of a process in which they admit we were making stuff up, we were arbitrary and capricious, we did immense damage to people's lives, literally probably much more damage than COVID did. We're fired. we're fired. We're leaving this field because we can't bring anything positive until there is some process of reconciliation and admission of blame. There won't be any healing. But this goes back a long way. This goes to climate change as well, which we talked about in the past, which is until there's an admission that the process that the interpretation of actual scientific information was corrupted. And here's why, and here's how we're not going to do this again. You won't get a restoration of trust. And I think that's all there is to it.
Very well said. The essay in the Fraser Institute is COVID-19 Hygiene, Theater, Masks, and Lockdowns, Solid Science in air quotes or scare quotes or science veneer. And that is by Dr. Kenneth Green. Always a pleasure. Thanks for coming back on.
Oh, it's good to be with you.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.